Okay, well, why don't we go ahead and kick things off and get started with our meeting today. Welcome everyone to the Addressing the Caregiver Crisis, How States and Communities Can Better Support Military and Veteran Caregivers Learning Community. This is the third and final session of this learning community. So we've had two wonderful sessions previous to this, and we're really excited to wrap things up with a look at strengthening community supports and promoting financial wellness for military and veteran caregivers today. So I am Angela Wright. I'm a senior project associate at SAMHSA Service Members, Veterans, and Their Families Technical Assistance Center, and I will be serving as the session moderator today. A quick disclaimer before we jump into everything: the views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of SAMHSA or HHS. All right, so our agenda today, we're going to follow the same pattern that we have throughout the past two sessions. So this will look familiar to many of you. We'll go over our housekeeping items and learning community objectives first. We'll do some participant introductions. Then we will turn things over to our presenter today. So she can go over the first part of her presentation. Then we'll have some time for Q&A and discussion. And then we'll do the second part of the presentation, followed by additional Q&A and discussion. And then we'll wrap things up by 3:30 p.m. Eastern time today. So just to make sure that we're having an inclusive virtual space, we'd ask that you set your name to how you'd like to be called during this meeting. We're definitely going to be having some time for discussion, so that's helpful to me facilitating this call. Also, while we're in discussions, if you'd like to turn your video on, that would be wonderful to see your smiling faces. If not, that's okay too. Please make sure your microphones are muted unless you're speaking, and then we will be using the raise your hand or chat function features to communicate with the group today. So our learning objectives for today's session, we will be highlighting the challenges caregivers face related to financial wellness and also the resources that are available to help. And then we are going to be illustrating how states and communities can come together to support military and veteran caregivers. So I know you guys probably know the routine by now, but let's go ahead and introduce ourselves in the chat. Share your name, your agency, the state or territory that you're coming to us from. We're so excited to have all of you here today. Glad to see many familiar faces back on the call. With that, I'd love to turn things over to the Military and Veteran Affairs Liaison at SAMHSA, Stacey Owens. Stacey?
Thank you so much, Angela, and thanks everyone for joining us for this third session, rounding out our series on military and veteran caregivers. We're so appreciative to have Sean Moore here talking about financial wellness for caregivers. And, you know, if you really think about the impact of caring for a loved one who has had a severe mental or physical health injury, and then also thinking about the burden of waking up every day, not really knowing how you're going to afford things like housing or food for your children, you can really think about the impact that would have on a caregiver. And we're so fortunate to have Sean Moore joining us to share her perspective and her passion for the caregiver community, as well as her knowledge. And we appreciate all of you for joining us to hear more about this important topic. And I'll turn it back over to you, Angela. Thank you.
Thanks, Stacey. And thanks everyone for introducing yourselves in the chat. And feel free to say hello to each other and communicate in the chat throughout the call. So with that, I am so pleased to introduce you to our session presenter today, colleague and friend, Sean Moore. She's the founder and executive director of Caregivers on the Home Front, and also program manager of financial wellness at the Elizabeth Dole Foundation. So she brings with you lots of experience, both personal and professional, to share with you today. And it's always just such a pleasure to speak with. So I'll turn things back over to you, Sean. You can tell a little bit about yourself and your role.
Hi, everyone. Thank you, Angela and Stacy and Emily. I am so excited to be here. I am just so passionate about this work and am very grateful that you all tuned in today to hear this presentation. Next slide. So I want to tell you my why. We all have a why, right? We all have whys and the reasons behind why we do what we do. And a couple of pictures here because this kind of says it all. My husband, as you see in this top right hand picture, him and I met in 2013. He was being medically retired from the military after 23 years in the Army. And my husband completed 7 tours to Afghanistan in a special operations unit. I love this picture of him and I because not only is it my favorite picture of our wedding, because it's one of those not scripted photos, but what I want everyone to pay attention to is, as I just said, he was medically retired. Does he look like he should be medically retired? No, he doesn't. And that is one thing that we talk about, those invisible wounds of war, and where even to this day, people have a really tough time understanding that I am his caregiver and why. And it is due to this next bullet point. In 2017, my husband had his first, as I say, first suicide attempt. It was his, I would say, the one that we about lost him on. And I quickly realized then that there was hardly any support, at least for me in Kansas City, Missouri. There was no support for me here, and nor my children. I left a career then of being a police officer after 15 years because being a police officer and as a patrol officer, it was really hard for me to come home when he called and said, "Hey, I need you to come home." This other picture that I put here is just last week. And I think it is very prevalent because since I've met my husband just last week, I feel like everywhere I go where we're talking about veterans and maybe their family members and caregivers, I always stand up and go, what about those families and caregivers? And I'm still doing it about 10 years later. So as much as we've come a long way, we still have a long way to go to make sure these family members and caregivers are being included in anything that we're doing when we talk veteran. Next slide. So I imagine a lot of you have heard some of these numbers, but I want to go over them just in case you haven't. In 2014, the Elizabeth Dole Foundation commissioned the RAND Corporation to do the first of its kind ever deep dive into those hidden heroes, those family members and friends caring for our nation's wounded and ill and injured service members and veterans. And at the time, well, just a little side note, we are in the process of updating this research because that was a little while ago. And our last numbers are that there are 5.5 million military and veteran caregivers. And I am sure that that number has risen since 2013. Another number that's probably risen as well, but this is still astronomical. These caregivers provide $14 billion of uncompensated care each year. So these caregivers are keeping veterans out of long-term care facilities. They're keeping them out of the hospital for longer and keeping those hospital stays shorter because there are family caregivers at home taking care of veterans, but not to a detriment of their own health. We know caregivers experience worse health outcomes. We know there's greater strains in family relationships and more workplace problems than non-caregivers. And one of the things I really want you to think about here is when a loved one does attempt suicide, does have PTSD, TBI, those mental health challenges, we know through research that that is a predictor of a greater strain on family relationships, period. Time spent giving care and helping the care recipient cope with behavioral health problems contribute to depression in caregivers. So as we oftentimes hear about the veteran, we have to know and understand that what the veteran is going through does affect the family, and it can affect them in negative ways. Dr. Roxana Delgado, who I'm sure many of you know and have heard from, I am going to reiterate her study that her and her colleagues did on a sample of 458 spouses who were caregivers. 39% of them experienced interruptions in their education, and 23.6% of them reported suicidal ideation since becoming a caregiver. I don't know about you, but those are high statistics, and that's since becoming a caregiver. So not before, it's after. So what are we doing, and what can we do to help those numbers come down? So she went on further to indicate that an interruption of life events, a loss of self, and caring for a veteran with mental health conditions and suicidality are significant predictors of suicidality in military caregivers. Next slide. So we would need to understand these military and veteran caregivers because it is different. I'm not a veteran coming to you, talking to you about veteran caregivers. Just as much as you would not probably want me coming to you as a caregiver talking about veterans, because I'm not a veteran. Yet I do have the lived experience of a caregiver, and I have the professional mental health background of what these caregivers really need to thrive. And I'm going to read this because I think it's really important. Caregivers who care for veterans with trauma-based comorbidities, such as PTSD, depression, anxiety, and substance abuse have reported intensive caregiving and significant levels of distress, depressive symptoms, and other negative consequences. These caregivers require comprehensive support services, including access to health care, financial assistance, and enhanced respite care. Do you know that just because a veteran has VA disability benefits through and getting their care at the VA, that does not mean that other family members have health benefits. They may not. Next slide. So what are some barriers to financial wellness for caregivers of veterans? Just like Roxana Delgado's study found, caregivers leave their careers in higher education to care for their veteran. Oftentimes, becoming a caregiver is not something we go, I wonder if I want to become a caregiver or not. It's thrust on us with little to no warning. We take on that entire identity of caregiver, and that's who we become. Yet, that leads us to a lack of money going into retirement. We're not paying into Social Security benefits. And again, we may not have health insurance, and we probably definitely don't have life insurance. There are a lack of forward-thinking employers who support caregivers in the workplace. Yet, COVID, there are some positive things around COVID. And one of those are, we're paying attention to caregivers now. There's probably been the talk of caregivers more in the media in the last couple of years than there ever has been, which is a good thing. It was also a good thing that employers went to remote work and now hybrid work, because that's really what caregivers of veterans need to stay in the workplace. It's so important. They also have a lack of childcare. Many of them cannot leave their children home with the veterans that they are caring for. There's a lack of resources to aid the caregiver in employment. How many of you have seen job fairs only targeted to veterans? Yet we know the veteran is not the only one who transitions out of the service. That family member does as well. And if that family member is a caregiver and that service member is transitioning out as injured or ill, they're not coming into the workplace. But that caregiver or family member needs to. So they need just as much help around transition services into employment with resume writing and skills training, just as much. Benefits end upon the death of a veteran or a divorce from a veteran. I know oftentimes we don't want to think about that, but it's going to happen. It does happen. And oftentimes, if we are not caring for the caregiver and their own financial wellness, they are left with nothing when the benefits stop, or hardly anything at all. And unfortunately, here in the past few months, I've seen caregivers where their veteran has passed away and they are living in a car now, because we did not set them up for success when caregiving ends. Next slide. So in this national survey, 62.3% of caregivers depleted assets and or accumulated debt, and 41% of working caregivers left the labor force. If a severely injured veteran needed intensive help, the primary caregiver faced odds 4.63 times higher of leaving the labor force and used $27,576 more in assets and or accumulated debt compared to caregivers of veterans needing little or no assistance. We know there are many disabled veterans. Look what that is doing to our caregivers if we are not taking care of them. Those are huge numbers. Next slide. So, what about this? What are some of the biggest challenges regarding financial wellness that you see in your work with military and veteran caregivers.
Thank you so much, Sean, for laying out the challenges that our caregivers are facing. In our next segment, we'll be talking about some of the resources that are out there that can be helpful. But we'd love to hear from all of you. If you have any questions so far for Sean, or if you have any insights to some of the challenges that you're seeing, or building off of anything that Sean has just shared with us. Does anybody have anything they would like to share with the group?
Can anyone on the call relate?
Albert, go ahead. Yeah, thanks. Albert, you're on mute, sir.
Okay. So my job is, we've been in business since 2007, and our job has been to connect service members and their families with community resources. So I'm very aware in terms of the referrals we get of the lack of resources for caregivers. We've developed some workshops. We do a lot of advocacy. People are beginning to hear us in Connecticut. They added a new staff person to us who's a case manager who's going to devote a lot of her energy towards working with spouses and women veterans. And along the way, we'll probably be gathering a lot of information about where the gaps are. We're plugged into all the major systems. So once we have that data, we'll begin really fiercely to advocate for an increase in those resources. That's it.
That's going to be key. And Albert, I would encourage you when you're talking with your new staff member to really remind everyone that you're working with that our veteran caregivers aren't only spouses, and I know you know that, but really we need to make sure that we are providing these support services also to these veteran caregivers who are the adult children who are taking care of our veterans. If you think about when a service member goes off to join the military, they're young. So when they come home, if they come home injured or ill, they may be coming straight back to their parents because they were so young. So those parents may be needing some support, and siblings. There's siblings that are taking care of our veterans as well. So it's really important that we be inclusive when we're talking about veteran caregivers, and make sure we include all of those family members and friends who are taking care of our veterans.
Our program was built to be inclusive. So right from the get-go, we were open to spouses, children, grandparents. I'm also a family therapist, and from a family systems perspective, when one family member is chronically ill, it affects the entire family system.
That's why you're doing such a great job, Albert. I love family systems therapy.
Well, one of the things, I have one complaint, okay? There's an awful lot of great VA websites about caregivers and caregiver support, but they're not backed up by action. So a lot of times you call to get services for caregivers, and either you don't get an answer back, or they don't have the resources to deliver what they say on the website. So this is I don't know if anybody audits those things, but this is a big problem.
Thanks for bringing that up. And Nancy, I saw you had your hand raised earlier. Did you have something you wanted to add?
There's a big gap in USA jobs and recognizing the spouse or the caregiver who now has to shift and trying to find better employment or more stable employment. in order to keep the household together. I found when I was trying to use the system, you click that you have the vet's status because your veteran can't work, so that status transfers. But then there's really no way for you to actually click through the other pieces. So you end up lost, I'll call it lost in the woods. So you're like not in one bucket, you're not in the other bucket, and there's really no way to flag it properly so that you get those points towards the employment. So my guy went down and wasn't able to work anymore, but he could take care of himself. But I was in a position of needing to transition and find another job. And even though I should have been able to readily access his percentages to pull them over, when it came down and you start to click all the buttons even aren't there. So you're kind of like jury rigging it in, and then they kind of look and go, well, this doesn't match, and you kind of get thrown off the pile. So there needs to be that ability. Are you a caregiver? Are you transferring your vet's percentages over to your application?
Yeah, sounds like there's a gap there that maybe we could.
Yeah, it was a very real gap. I have not investigated that gap, I'll say, in the last 5 years, because his health deteriorated and instead.
I mean, I'm always looking for,
less expensive place to live.
But I think one of the things is somebody has to gather the data, and then the data informs the advocacy effort, but in other words, I mean, first of all, I wasn't aware of how huge the gap is and the deficit until this year. We were trying to we had several referrals at Caregivers, and then we hit this brick wall where you're making call after call after call to the people responsible for the caregiver program, and they never call you back. So then it's a question of what's the chain of command there that you can walk up until you get to a congressman and say, you got to do something about this.
And I'll say, it's very nice that you want the data collected, but when they don't want to find the problem, they're not going to put the money into the data collection.
Well, we have a way of tracking our own data.
Yes, but that's just your little window.
But
I was working with the state of New York, and I was trying to go through USA Jobs, and I had somebody at the Montrose VA hospital attempting to help, but even with that, the challenge just fell through the crack, and nobody really wanted to acknowledge it. So you ended up in that catch-22. And I'm going to say, beyond employment, I sat and lost, I'm going to say, somewhere in close to $50,000 in the fact that there was a misunderstanding as to when Champ VA can kick in if you were working. So I didn't think I was eligible until I no longer had a job, which I didn't lose my job because I wanted to. I lost my job because I got laid off. So then I went and applied, and then it was like, oh, well, you've got X amount of months to go back to when you actually were eligible at 100%. Well, that's very nice, but if all of a sudden you're in the throes of caregiving big time, you don't have the kind of time to pull all that data together for a number of years to then submit it. So then you've lost that revenue stream because it's gone and you have no way to recover it because there's just no time in which to do it. So that's why I said some of it is the design of the thing. There shouldn't have been a question when it shifted to 100%. The DAV, 7th Avenue, New York City, didn't know what a caregiver / spouse was entitled to at the vet's 100%. They were willing to look, God bless them. They really were. They were willing to try. The American Legion's answer is, well, unless your vet is here with you, we're not going to speak to you. I'm like, excuse me? So that got into an interesting conversation with Department of New York for the American Legion. But that's what I'm saying. There's such gaps in even the data being available in a consistent and reasonable fashion that's actionable for that caregiver slash spouse, to be able to even figure it out on their own. There's lots of websites, but they're scattered all over the place. And there isn't a, here's your checklist.
Yeah.
Which would really be wonderful. Here's your checklist. Here's what you're eligible for. Here's how you access it. Here's the people you need to speak to. You know, a lot of us can work through a checklist, but
Like a welcome to
when we're
welcome
kind of just trying to
here's what you need
find it on our own, good luck. Yeah, just all of the
I'm
sources
sorry.
in one
I'm
place.
sorry I use that word data, but I have a different perspective because I'm connected with a large state agency. We're funded through the Department of Mental Health and Addiction Services. We're very integrated into the Guard. When we talk about gaps, people are listening, and they have responded. The issue now is they responded enough to give us a full-time case manager devoted to women's issues. And they had caregivers and female service members in mind. And they know there's a gap there. So we're only rolling for 3 weeks, but already we're seeing a lot of referrals that we wouldn't have gotten without this person. And each case we're analyzing what are the needs and can we meet them and where's the resource to get them. And as each case comes in, we're going to get a much better picture of what's possible and where the gaps are. And we're going to communicate that piece. We don't need a hell of a lot of people to communicate that piece, the gaps, and then keep on pushing until we get some breakthroughs.
Yeah, I appreciate that's a really good systematic approach to finding out where the needs are and getting some buy-in to address those needs for sure.
Yeah, it's called. Yeah, but I mean, you know, I do research. I started out before I was a family therapist in sociological research. And one of the types of study is a case management method, where you analyze the case, you take a look at what needs you can fulfill, where the gaps are. Then you go to the next case until gradually after 10 cases, you've built up a picture of what we're getting an A in and what we're getting an F in. And then you can begin to refine how do we plug those gaps. We're not going to work on everything because a lot of things are working well, but some things aren't.
Yeah, absolutely. Thank you so much for your comments, Albert. And I see also Emily Watson in the chat has shared some of her perspective too around gaps in healthcare coverage, and also that she's seeing caregivers foregoing care just to not impact the household budget, maybe foregoing insurance and then not going to the doctor when they probably should be. Does anybody else have any thing to add to that? Thank you so much for that, Emily. Well, I really appreciate this this robust discussion, and we'll have some additional time to talk as well after this next segment of our presentation. But I'd love to dig into some of the resources that are available and turn things back over to Sean so that we can talk a little bit about, well, we know what the challenges are, what are some of the things out there that can help? Sean?
Absolutely. Thank you all. And everything that you have said, I want to validate because you're all spot on. Some of the resources that I put here, one, the Elizabeth Dole Foundation, they are in their 11th year. I became an Elizabeth Dole Caregiver Fellow in 2017 for the state of Missouri. It was one of the really first resources that I came across and really got involved. And I feel like that was really my launching point of getting into this space. And then years later, I happen to work full time with them now in financial wellness. Last year at about this time, they opened this new position for a program manager for all things financial wellness because, as we know, if you're looking at the holistic support of a veteran family unit, finances play a huge part in the mental health care of that family as well. So what we have done, and I'll talk about this on some other slides too, so I won't get too deep into it. We've got some financial wellness courses and then a critical financial assistance program that I'll talk about here soon. One of the things that I also did when I got in this space and saw that there were gaps in some of the offerings for caregivers, I didn't want to recreate a wheel because there were some good things out there, but there were some gaps. So I started a nonprofit called Caregivers on the Home Front, and our programs are specifically geared towards the mental health and wellness of those family caregivers and those children living in caregiving homes. Another resource I put on here is Hiring Our Heroes. They are becoming more inclusive to those caregivers. And why I say that is because, remember, caregivers are not only spouses, they're different demographics around who those caregivers are. So when you go into Hiring Our Heroes and you look at their menu that comes down a checkbox, there's actually one as a caregiver. So we're super excited about that, but they offer resume writing skills. There's fellowships and internship opportunities available for caregivers. And next slide. And then AARP, in the last year or so, they have a job center now for veterans and family members. This link here will take you to that, or you can just go to AARP and search for that job center. They also have a lot of other great things for the caregiver. I saw in the chat, I think Stacy put this in the chat, the Department of Labor has a transition assistance program that they now have something specific for caregivers. So you can go in there and check that out. I love seeing, like I said, when I first started about 10 years ago, there wasn't much, but 10 years later, there are some great things coming about, and we're doing a really good job of identifying. We can't only say military spouses, we need to say caregivers. That's part of being inclusive. Psych Armor, if you haven't heard of them, they've got some great courses, and one of those is Your Financial House in Order? It's a short video, but it really gets people, not only caregivers, but veterans, to really think about what their finances are. How are they in their household? Next page. All right, so what I wanted to talk to you about is one of the Elizabeth Dole Foundation's programs. It's our Hope Fund for Critical Financial Assistance, and it was named that because we got a very generous grant from the Bob and Dolores Hope Foundation, which many of you know has provided resources and entertainment to military veterans and their caregivers for a very, very long time. And what this critical financial assistance program does, one, it's for the caregiver. It is for the caregiver to fill out, not the veteran. We don't need the veteran to fill it out. We don't even need the veteran to say, yes, fill this out. It's for the caregiver. They may be on the brink of homelessness. They may be struggling to pay their electric bills. we've got high utility bills this year, right? It may be due to a job loss. It may be due to underemployment. It may be due to them being a caregiver. Unexpected care costs, exactly what Emily said earlier. Yes, we do see this happening, and we see it in those caregivers who are applying for help. And a lot of that is they don't have dental insurance. So they can't even go and get dental work done. This is something that this program would pay for. Next slide. There's not very many qualifications. You just must be providing care to a wounded, ill, or injured veteran or service member. And you do have to submit a DD-214. If you're in the VA caregiver program, you can submit that letter. You can submit a VA identification card, a benefits letter. That's about the only thing that we do need from the veteran, unless you are in the VA caregiver program, and then you can use your own letter. You must be seeking financial support for services completed within the 50 U.S. states and territories. I will tell you as well, we don't pay the caregiver or the veteran. The money will go directly to that vendor, such as the mortgage company, the dentist where the caregiver is needing support, needing services. Same with kids. Oftentimes our kids don't have dental care. Mental health care is hard to find. So we've had them ask for services such as that as well. You can find that by going to hiddenheroes.org. There's a Find Help tab, and then it will say Hope Fund. Next slide. So how can states and communities help? So one thing that I mentioned early, we've got to recognize that that caregiver is transitioning as well. They may be that sole breadwinner when the service member is coming out of the service. So we must target caregivers. So on your, I see job fairs all the time targeted towards veterans. If you know anything about the military, while that person was on active duty, if it did not specifically say your family was invited, your family was not invited. And we know a lot of these cultures, they come into the veterans world as well. So let's do that next best thing, be inclusive in your marketing, market to spouses on these hiring job fairs, market to caregivers as well. Caregiving has become a social determinant of health. Those of you that are in government, state government, local government, let's do a better job of identifying that it is a social determinant of health. Being a caregiver leads, there's research already here around it. We know that the mental health of the caregiver declines. We know that their finances decline. Those are all social determinants of health. So we want to involve those state departments of mental health. Let's make some awareness campaigns, because the more we talk about it being a social determinant of health, the more research is involved, the more funding is available. That's how we're going to make sure that we're taking care of the caregiver. We also have to educate employers. Caregivers need flexible work hours. I'm a caregiver. I work full-time. I'm actually at home. I'm a remote worker. The Elizabeth Dole Foundation is in Washington, D.C. I am in Kansas City, Missouri. I can still find enjoyment in my work. I can still pay into retirement. I'm still paying into Social Security. And my family is still being taken care of. And they're going to be taken care of after my loved one passes away and after caregiving ends. We need hybrid work environment. Sometimes it's nice to come into the office, but not all of us can. FMLA is huge. We need to extend that. But it's about us educating the employers. Most of the time, we are not raising our hands and going, I'm a caregiver in your employment, because we're scared to do so. We need to make it where employers understand that they have caregivers in their employment. Next slide. So here's some impacts of caregiving, and this looks at why caregivers may not be staying in the workplace or why employers don't hire caregivers. Caregivers who went in late or left early or took time off, 53% of them. 15% went from full-time to part-time work. 8% received a warning about attendance or performance. 7% turned down a promotion. 6% quit working entirely, and 5% retired early. If you look at those numbers, that's not good for setting our caregivers up for success when caregiving ends. Next slide. So what are the benefits that support caregivers who are in employment still? 58% of caregivers said that they have paid sick days. 56% of them have flexible work hours. 39% have paid caregiver leave, and 26% have programs that help caregivers. Think about it. So a caregiver is at work. They have a home health aide taking care of their veteran for the day. Yet that home health aide called in sick for the day. So if an employer is offering paid backup care, that employer doesn't have to leave work for the day because they're offering a benefit for those caregivers in employment. It's so, so important. And one of those benefits, one of those employers who are offering benefits is Deloitte. 79% of caregivers don't have access to caregiver support benefits in their workplaces. But Deloitte has came along and is providing 40 days of paid time off annually to pay for those who are caring for a spouse, a domestic partner, a parent, an adult child, a sibling with a serious health condition. That's huge. Next slide. So what are the things that employers can do? We've all heard of employer resource groups. Many have veteran employee resource groups. I would challenge employers to take that one step further, to have caregiver employee resource groups, not specific to who they're caregiving for, just a place that all caregivers can be seen and heard and get resources from each other, and to support the well-being and mental health of each other in the workplace. Although our resources may be different, but oftentimes in the veteran space, we only look at veteran resources. And sometimes as caregivers, we need to look outside of the veteran space because there aren't the resources that we need in the veteran space. And in caregiving, respite care, that comes to mind. That comes to mind. SHRM has an excellent article. They have excellent things that they are doing to educate their human resource, people and talent acquisition, people on what caregiving looks like in employment and how they can best support. AARP is another thing. They have a military caregiving employer toolkit that I have resource that I've linked here. What does the Elizabeth Dole Foundation want to do? We actually want to come in and talk to your employers, talk to your human resource people. We want to talk to your employee resource groups because we want to give them these ideas so we can make it easier for caregivers to stay in the workplace if they so want to or need to. In that article that SHRM put out that I linked here, it talks more about Deloitte, Microsoft, and what some of these places are offering their employers who are caregivers, offering that paid family leave, making it okay for caregivers to have flexible work hours. So if I need to take my veteran to his or her appointment, I'm still going to give you my full 8 hours. It just may not look like from 8 to 5 or 9 to 5. Remote work. I can take my loved one to the VA, make sure he gets to his appointment. I can sit out in the car because my job's remote. It's an excellent perk. I can still be a caregiver and still make sure that I am setting myself up for success when caregiving ends. We should do a better job of offering internships and fellowships because some of us got out of the workplace for a while to caregive for our loved one. So we have a gap on our resume. If more employers would offer internships and fellowships, it's going to be good for the employer. It'll also be good for the employee who is the caregiver who doesn't quite know how getting back into the workplace is going to work with caregiving. So give them some baby steps getting back into employment so they can see that it will work, especially when they have an employer that understands who the caregivers are in their employment. Next slide. So let's get into this discussion.
Thank you so much, Sean. I appreciate you sharing all of those great resources. And I really like how you frame setting up a caregiver for success after caregiving, because we all definitely are thinking about, well, the challenges and needs during their caregiving role, but thinking ahead to that time where they may not have the benefits available to them, what's going to help in the long term. So I really like that forward thinking that you're sharing with us today. I'd love to just be able to have some time to share resources that you all use and know of. If you want to unmute and share verbally or put things in the chat, I invite you to do that as well. And the other thing I would love to hear from each of you, if you could take a little time to think about it, is what is one takeaway that you learned from this 3-part learning community, whether it was today's session or one of the 2 other previous sessions that you were able to attend. I'd just love to hear the takeaways that you'll bring back to your work going forward. So who would like to kick us off? Yes, Kathy.
Okay, I have a question about what is the hidden heroes thing. My soon-to-be son-in-law is a wounded so sorry, I'm tired. Wounded warrior. And he has a daughter with SMI and some physical health issues. And for whatever reason, I just assumed that she was being taken care of by TRICARE. And I just found out that she is not. So they were having a wedding next summer. Just found out yesterday that they're having a simple wedding next week. So my daughter can get my soon to be new granddaughter on her insurance. So since she's going to be, that's the caregiver then of a wounded warrior, right? And
Yes.
would she be able to apply?
Yes, so the
this.
caregiver, yes, the caregiver can apply for the Hidden Heroes Hope Fund so that so that they can look into getting those expenses that weren't covered paid.
Okay, that's the biggest takeaway that I've got then, because I just was kind of blown away by that. But I want my new grandchild to be taken care of. So
Yes, absolutely. And so one other thing that I'd like to mention on that program, we look at applications. We take applications all the time. We process applications the 1st through the 10th of the month. So if you happen to get it in on February 11th, just know that we won't look at it until the 1st of the next month.
okay.
We'll look at it, but it just won't be until then.
All right, thank you.
Thanks, Kathy. Anything else folks would like to share?
Teresa, I was going to expand on what you said, that, we oftentimes only think of caregivers as spouses. I also want to throw in that not all caregivers are female. There are male caregivers taking care of their female veteran spouse as well. So don't discount them, because they oftentimes they really have a tough time identifying as a caregiver. So it's up to us in all of our roles to be asking when a veteran and they come in with their family, or maybe they don't come in with their family, ask, do you have anyone that's helping take care of you? Ask them. You have to ask. Sometimes they won't offer that up.
And thanks, Catherine, for your takeaway that around the gaps around when caregiving ends as well. That was such a powerful thing that I think that you brought up, Sean, today. So thanks, Michael. Yes, I will be sending Michelle, I'm sorry. I read Michael, but it's Michelle Parr. I will be sending out the slides and the recording from today's session to everyone. So you'll be able to have those in hand, and anything from the chat log as well. So if you have any resources you wanted to share there too, please feel free to add your links.
One of the things that I didn't bring up in the presentation that I think this group would be very well served to know is, and some of you may know this, a lot of our disabled veterans, especially those who have mental health challenges, and take that one step further, especially those who have attempted suicide, they don't have life insurance. They don't have life insurance, and many, because they were injured as they were before they transitioned after the military, they didn't get that VGLI or SGLI switched to VGLI. So they don't even have that. So when I talk about setting our caregivers up for success, you have to know that as well. They may be in a family when a veteran passes away who has no life insurance. Now think how devastating that is going to be. And that's a very, very real world. I'm not even going to say it's an example because it's reality.
Yeah, I appreciate you bringing that up, Sean, too, and a really good resource for that, I know, is the VA's just released their life insurance, the VA life insurance for veterans with new eligibility rules, low cost. I'll try to get a link for that for you all in the chat,
Yeah.
so you guys are aware of that.
It would be a great resource for you all to have, and a great one to get the younger you are, the cheaper per month it is. If you're in your 50s, 60s and above, it's getting really pricey. Now, granted, that the price point doesn't raise, it doesn't change. But I dare say if someone's in their 70s or 80s and they look at the monthly amount, they're not going to be able to afford it. So utilize that as a resource, especially to our younger veterans, and get them to get signed up now.
I just put that link in the chat. All right, any other thoughts or reactions from the group today? I really appreciate everybody's insights on this call and being able to speak openly about our experiences and just having a supportive place. I think we're all kind of on the same path and trying to improve the lives of our military and veteran caregivers. So I really appreciate everyone's input here. Yes, sir, Albert.
I really appreciate the links. There's a lot of information here I didn't have, and it's coming at a very good time. So I can give the recording and the links to the care manager that we have now. And I know it's going to make an impact. It's going to make an impact on the way we deliver service and hook people up. So I really appreciate it very much.
Great, thanks. I'm so glad to hear that, Albert. Timing is everything, isn't it?
Yes, and please, for all of you, my information is on the slides. If you ever have a question or resource, if you'd like for us to come in and present to a group of people, please just let us know. But I am, even if you want to shoot me a quick email just because you're looking for a resource for a caregiver and you're just not quite sure, or you missed the link of something that the Elizabeth Dole Foundation is doing, please just email me. I would love to hear from you.
Absolutely. Well, I think I'll, if no one else has anything, I think I'll go ahead and wrap things up. But I did want to share one of my takeaways is that caregiving impacts everyone. So it's not just the service member or veteran or the caregiver themselves. It impacts our employers, all of our systems that we have in place, the children. And so I think this is just such an important issue that we really need to pay attention to. And I want to thank all of you for being here and taking active steps in improving the lives of military and veteran caregivers. So thank you so much. All right.
Thank you, everyone. Coming from a caregiver, thank you. I truly appreciate all your work that you're doing. It's so needed.
So I'll leave you with a little bit of homework, and that is to share one or more of the resources that we discussed today with your network. So If you could just take one of the links that you found particularly useful and you know somebody it might help, send it off to them or share it on social media or LinkedIn or wherever you feel like it'd be most useful. Please make sure that this information doesn't just sit with you, but it's shared with everyone. So I appreciate everything that you're doing and thank you all for joining us in this 3-part learning community series. It's been wonderful. Thanks again to Sean for presenting today. You did a wonderful job and just have a wealth of knowledge to share. So with that, thanks everyone. We'll let you go a little bit early today, get a little bit of time back in your day, which everyone I think knows is of great value. So find something for yourself maybe that you can do in the next 20 minutes. All right. Have a good one, everyone.